Hey, Eastern Oregon, thank you for joining us tonight. This is a special conversation that we're having tonight about vaccination with 3 doctors in the studio. It's going to be a lot of fun. So this program tonight is brought to you by Grand Ronde Hospital and Center for Human Development. And this is an important topic. We're glad that you're here. Glad that you're here. I would just, consider taking this in. As you know, vaccinations are kind of a hot topic, both directions, and we want to be able to present some information for you that will help you make wise decisions. And you're not going to get everything that you want to hear tonight. And so you're going to need to follow up with your medical professional, your doctor, and sit down and have some of these same conversations or a little bit further of conversation. But I'm really privileged for these 3 doctors to be here in the studio with me. And I'm going to let them introduce themselves. So,
hello, Eastern Oregon. I'm Josiah Ward. I'm a board-certified pediatrician. I've been so for 10 years. And I've recently been made the medical director of the Regional Medical Plaza here at Grand Ronde Hospital. I'm excited to be part of Grand Ronde Valley, and my wife and kids, 7 of them, are excited to be back in the Northwest. I spent 10 years down in Texas, training in the Air Force, and then spending 10 years at a hospital system down in West Texas, operating as medical director, chief medical officer, as well as officer in charge of immunizations with the Goodfellow Air Force Base down in West Texas. Excited to be here amongst wonderful colleagues to discuss this very important topic for current Oregon health events.
My name's Summer Shumsky. I'm a family medicine physician. I currently work at Wallowa Memorial Hospital in Enterprise. I do broad spectrum family medicine, seeing patients in the clinic, taking care of them in the ER in the hospital, and also doing obstetrics care. Before this, I was in Boise, Idaho, doing broad spectrum family medicine training, and then did an additional fellowship year in rural emergency medicine. So I'm really happy to be back in Eastern Oregon and happy to be here tonight to speak to you all.
I'm Dr. Frank Shumsky. I'm a board-certified family practitioner. I've worked in medicine. My career spans about 30 years. In that time, I've done inpatient hospital work, outpatient work, acute care. I've been a hospice director, nursing home director, and did acute care at a tribal clinic. Happy to be here.
thank you guys for being here. So, and Frank, Dr. Frank, you are the current Union County Health Officer.
I am.
Yeah. Tell me what that person does.
Well, I see my role there twofold. One is just to be a resource. There is a large crew of dedicated public health employees that work from school-based health systems to immunizations to reproductive health, mental health, addiction medicine. It's quite a resource, as well as being sort of a conduit from the Oregon Health Authority through to CHD.
Awesome. Now, you and I have met before.
We have.
Dr. Summer and Dr. Josiah are new to me tonight, but it's good to see you again.
It's good to see you again.
Yeah. So let's talk about vaccinations from a little bit broader sense.
I think that's a great
what
idea.
What happens? Yeah.
Yeah. So, well, first off, what is a vaccination or an immunization or the jab or a shot? It's not always a jab, by the way. It's essentially a mechanism to allow your immune system to identify a disease and then be prepared to defend yourself against that disease once you're exposed. That's what happens. Why do we do it? Well, immunizations are probably one of the most important public health tools that we've had in history. It has helped eradicate smallpox. It has decreased measles deaths from 2.6 million worldwide to less than 100,000. So there's lots of reasons to do it. It helps develop herd immunity. Also, if we do get sick, the illness will be less severe and we're less likely to die.
Okay, so, but we're here for a particular reason, and that is, there's been a decrease in vaccination rates. And why is that? What's happening?
Well, I'm not an epidemiologist.
Yeah.
However, if I put the retroscope on, in my career, I think what we went through as a community and as a nation and as a world through COVID-19 and the advent of social media and Google and online presence has really shaken up people's trust in many, many things, healthcare being one of them. This is important. Specifically, let's talk about measles. I had mentioned herd immunity, and herd immunity is where if you vaccinate enough of a population, typically, depending on the disease, 70 to 94%. If the 70 to 94% of a population is immunized, it helps protect those that are vulnerable, infants, elderly, folks that are unwell. Just today I got notification from Oregon Health Authority that measles vaccinations have dropped again, and actually it's somewhere I think in 68%. So we are vulnerable, and indeed there is measles identified in Oregon at this time as well as in the country. So numbers are dropping, and it's significant because it puts everyone at risk.
So let's go back to COVID-19 for just a minute, because yes, communication spreads way faster than what it ever did before, but part of it was, I mean, everybody was just surviving during COVID-19, including the vaccination people, the people that were creating that, everything. And so it was never an exact science. And so then, I mean, out of that, did people become more skeptical? I mean, talk about what has happened in the minds of people.
So the catchphrases, misinformation, disinformation, yeah. I think, and especially the younger generations today, get a lot of their information online. Whether it's social media, friends and family, social media influencers, and depending on where you look, you're going to get a different message.
Right.
So who do you believe?
Right.
Well, I think we're here to tell you who to believe and how to go about that.
Yeah.
I think you go to your doctor, you make an appointment with your doctor, you sit down, you have a face-to-face conversation, you say, am I at risk for this?
Yeah.
Should I where's my family at?
Yeah.
So-and-so's been exposed to measles. What do I do?
Yeah.
You need a trusted person that you can sit down with, leave your phone, shut off and in your pocket, in your handbag or whatever, and have that conversation and say, what should I be doing?
Yeah.
And then have trust. All of the physicians in this community are outstanding.
Yeah.
They'll sit down, they'll have the conversation, they'll know what to do. CHD is a fantastic resource where if folks don't have a provider, a doctor to go to here, they call up CHD, go to public health, and there are people there that will sit down and go through this.
Yeah. So I mean, I think the reason that people are afraid to have those conversations is because, one, they're part of their beginning that, mate, I can have this conversation. I can, enter into this. I mean, I think that's a new thing that people are experiencing. And, are they going to be shamed? I mean, help me, if I were a patient and I really wanted to have you tell me, why is this important? What would you tell me to help me enter into that conversation with you?
It reminds me of something that I went through as a younger doc, and it had to do with a pregnant mom who had 6 children, and she didn't want to immunize any of her children. And we sit down face to face every time she had a child, we would sit down and we would figure it out. Like, this was back when the H5N1, I think, was a big deal, 2006. Like, what should I be worried about now with this baby? What should I be worried about for my other 5 children? And you can figure it out. It's a work in progress.
Right.
Diseases change. Community health changes. First off, if a patient is worried about feeling shame because of their interaction with their provider or their doctor, they should find a different doctor. That's what I would say up front, because we're trained to deal with people. That's what we do. Our job is day in and day out, a one-on-one relationship with 10, 15, 20 people a day. And that's what we do. Really, I think that's been the privilege of my career, is having those relationships with people and that respect and the joy that comes with that. And you would never shame someone that you have that kind of relationship with. So I would say if you're worried about or are treated that way with your doctor, find a different one.
Yeah, thank you. And I think that, I mean, the thing about, and we see this everywhere with social media, is, I mean, you might have a fear of cops or an opinion of cops until you know one. And you know that person, you know. And it just changes everything, you know. And I think it's that same thing with physicians or doctor or whoever it is, you know. It's that fear is relieved, you know. I might not be excited about doing this particular thing in my health. I mean, whatever it might be. But if I have somebody that I know that cares about me and they recommend it to me, that's a different conversation.
Absolutely. I mean, I will trust these doctors sitting next to me more than any influencer or post or Google search I would ever do.
Yeah.
It's their job. It's what they do, day
Yeah.
in, day out, all
Right.
week long.
Yeah. Okay, so talk to me about adult vaccination. That's kind of one of your things. That's what you focused on, or vaccination rates generally. Yeah. So let's.
Well, we talked
let's
about
start
rates in general.
Yeah.
So if you, back in the day, the journal that I subscribed to, the American Family Physician, once a year would mail out a folder that was literally this big that I would put on the back of my board, and it was, you know, if they miss this shot, they need that shot, and if they're this age, they get that, and if that doesn't work, flip it over because there's that much information on the back. It is that complicated. You know, there are contraindications, so forth and so on. A lot of people also worry about the risk. Immunizations are safe. For instance, we've given in the world over 13 billion COVID vaccinations since the COVID-19 hit. And these vaccinations are studied rigorously. Where else can you have an N of 13 billion and see, you know, okay, what are we doing right and what are we doing wrong? I don't know if I've answered your question on that.
Yeah. Well, so I guess tell me what other. I mean, we've talked about the COVID vaccination. What other vaccinations do you recommend that adults really consider?
Oh.
Yeah. Yeah.
So
That they're not
adults,
maybe, yeah.
so we're talking 18 and over
Yeah.
as a population to 65 and then 65 and over.
Yeah.
So it's kind of there's a little bit of a schism. Those of us that are gray beards and blue hairs, we have a little more risk just because we generally accumulate some health issues as we age. That being said, I would, even if somebody was in for a sprained ankle, I would make sure their tetanus, diphtheria, and whooping cough was up to date. If it was flu season or COVID, I'd offer them a flu or COVID shot. You know, really, the adult vaccinations are much easier than my pediatric colleagues on this side of the table because that is truly mind-boggling. The schedule that does sometimes change, and of course, there's changes going on with the CDC versus what Oregon is recommending, and I think they will talk about that. But having a trusted physician that will do those things when you show up, so you know that you're up to date, is all you really need to worry about. And then, do I need a flu shot? Yes or no? Should I have a COVID shot? Yes or no? Is my tetanus up to date? I don't want to get lockjaw. It's 50% fatal if they don't treat it. I've never seen it. Everybody gets a tetanus shot. Like, it's that simple. But pretty straightforward. RSV is kind of a big deal. That stands for respiratory syncytial virus. Those that are older than 75 years of age should get one. There are over 100,000 admissions to hospitals for those over 75 with RSV, and 10,000 of those people die in the hospital from RSV.
Wow.
And of course, higher risk groups from 50 to 74 years of age should consider it as well. There's shingles vaccines, pneumococcal vaccines that you should have a conversation with your doctor about whether you need it or not.
Well, and I think that is the point. I mean, I'm sure we're going to hear over and over again, is that you just need to have the conversation. Because I think that sometimes, you know, people get so fearful. And when they get fearful, they're like, I'm not going to do anything. They throw the baby out with the bathwater. And you know, and that's the thing not to do.
Yeah.
Yeah. So, and in this conversation, we're going from adults and downward. Yeah.
Yeah. So the in-betweeners
Yeah,
are
yeah.
the pregnant women,
Yeah.
right? And breastfeeding women.
Yeah.
And I think Dr. Summer is has more expertise there.
Yeah.
Yeah. I just want to, before I talk about pregnancy, because I love talking about pregnancy, I just wanted to make a plug for PCPs, because we are both PCPs.
What's that
Is
mean?
I think sometimes a gap in immunizations occur when people don't have a primary care doctor, right? And they're only getting sporadic care at emergency departments who do a fantastic job of updating their Tdap when they have a sprained ankle or a cut that needs stitched up. Or they're only going into urgent care when they're having, cold and flu symptoms, but they don't have that trusted relationship with a primary care provider who, it takes time to build that relationship
does.
and that trust and provide that information that you can't give, necessarily during a more acute visit with a provider that you don't have a relationship with. So I think the first step is for people to find a pediatrician, a family doctor, an OB provider who they like and they want to see, and they see them regularly, to build this relationship and have those discussions.
Excellent.
So I think before we talk about a pregnant population, we should take a step back and talk about people who want to become pregnant, because in thinking of pregnancy, I think most people who want to become pregnant want to set themselves up and their baby up to be healthy, and really that can start from a preconception visit with your doctor, which is important in many ways to talk about maintaining your health and starting a prenatal vitamin, but also in getting immunizations that may be recommended before you even become pregnant. Things like if it's influenza or your COVID vaccines, or MMR, measles, mumps, and rubella, hepatitis B. Those are all things that you can get before you become pregnant to set you and your baby up for success and to be healthy not only throughout your pregnancy, but when you're postpartum and after your baby is born.
So put those dots a little closer for me. So why is that important for the mom to do that before she's pregnant or before she has a baby?
Yeah, again, I think some of that is sometimes a preconception visit is the first time a woman is seeing a doctor in a long time, since maybe they've been a child. And maybe there are some gaps in their immunizations. Maybe they're not up to date or have never been tested, or they don't know if they had an MMR vaccine as a child or a hepatitis B vaccine as a child. And those are things we routinely check in all pregnancies. When you first have an OB visit, we check those labs to see if you have antibodies to some of these things. And so if you don't, those are discussions we have throughout your pregnancy. Those are things we recommend for after pregnancy. If we know those things before pregnancy, we make sure that you're healthy and set up for a successful and healthy pregnancy.
And is that because you're concerned about the health of the mother, or you're concerned about the mother passing that to the baby?
Both.
Okay.
Yeah, both.
Yeah.
I think always both when you're talking about a pregnant person, right? You're concerned
Right.
about not one patient, but two patients, and not just during the time they're pregnant, because that diet is going to be separate at some point, and we want not only the mom to be healthy postpartum, but we want the baby to be as healthy and set up for success.
Right. And I think, I don't know, that's new information for me. I mean,
Sure.
I've never been a mom, but like that, but I think that generally, mothers will sacrifice their own health for their baby, whatever the case might be. But on the same hand, if it's put in the light of there's a chance of you passing whatever you might have onto your baby, that's a whole different discussion.
Sure.
Yeah.
And I guess as we think about moving into pregnancy, once a person is pregnant, it's like a joyous and wonderful time, but also a vulnerable time, because we know a mom's immune system is suppressed to a point in pregnancy because your body is carrying a whole other human that isn't you. And so your body does that as a way to carry a pregnancy successfully. But it also puts a mom at risk for illnesses and viruses. We know that moms are at really high risk for respiratory viruses like influenza and COVID. I think the general population thinks of those illnesses now, especially now that we're out of the 2019-2020 time of generally mild illnesses, but these are really severe illnesses in vulnerable populations, and those populations include pregnant women. And so pregnant women are admitted to the ICU, they are intubated, they are severely sick and can die from illnesses like influenza and COVID. Of course, that's not only putting the mom at risk, but the baby at risk. So those are some of the first immunizations we recommend when a person is pregnant and they're seeing a doctor. We talk about those risks and we recommend they get a flu shot if it's the correct season and a COVID shot.
So, and now talk about breastfeeding and the importance of that. Yeah.
Can I finish a couple of
Yes, I'm sorry. Yeah, go right ahead. Yeah.
There's two other immunizations I want to make sure we
Yeah.
hit on in pregnancy. One is the Tdap vaccine, tetanus, diphtheria, and pertussis. It's recommended in every pregnancy, no matter how many pregnancies you have, no matter how close together or far apart those pregnancies are. And really the key player there is pertussis, which is whooping cough. It's on the rise. We, all over Oregon, especially in Eastern Oregon, this fall had many cases of whooping cough. And for adults, it can be dangerous and it's very annoying because you get this persistent, long-lasting cough. But for infants, it's devastating and can be fatal. Babies die from this. So generally around 28 weeks of pregnancy, it's an immunization we strongly recommend for moms because that gives the mom's body time to produce those antibodies and pass it on to baby. So as you were speaking to before, something a lot of moms kind of gladly take that shot to help protect their babies. And then I make sure to have that discussion with the mom or the family during pregnancy to make sure other caregivers and family members who are going to be around this vulnerable baby who can't get their Tdap immunization for several months, I recommend that they get a booster too, because grandma and grandpa who are going to be there supporting the mom and baby could potentially introduce whooping cough. And so I just make sure everyone who's going to be close and loving on baby have their Tdap updated as well.
Yeah.
And then the last immunization I want to make sure we hit on in pregnancy is the RSV vaccine. I know Dr. Franks hit on it briefly, but there is an RSV vaccine that pregnant moms can get, especially in those fall to winter months leading up to the peak RSV season, which varies a little bit regionally and year by year, but it's generally September to January-ish. And moms can get it around 32 to the end of their 36th week of pregnancy, which is really fantastic because it decreases hospitalization rates in babies by like 68%. And again, a lot of moms, when I have this discussion with them, is like, you can get this immunization and pass these super helpful antibodies on to baby to decrease their risk of being very ill, hospitalized, especially in regions like this, transferred to another hospital out of state where there's NICUs and PICUs and things like that. It sometimes puts a different perspective on it for moms.
Cool.
And then lactating, breastfeeding, I think is a population that is forgot about in medicine a lot. But I think all of us can remember to keep having these discussions about immunizations for breastfeeding, lactating mothers, because pretty much all immunizations, aside from like smallpox and yellow fever, are okay in breastfeeding women. Even live vaccines that we generally don't recommend while a person is pregnant, it is okay to give when they are breastfeeding. They do not need to not breastfeed or pump and dump their milk after they get a vaccine. They can keep breastfeeding and providing milk for their child. Studies have shown that live vaccines, the live virus is not excreted into breast milk, so all safe in breastfeeding people.
Awesome.
Yeah.
So
I think again, like a vulnerable population that is easy to think of in like one unit when mom is still pregnant, but becomes a little bit more complicated and real once baby is born. And so I think pregnancy is a really great time to start having those conversations about what immunizations do you want for your baby when they're born, and you can kind of like set the framework and trust and relationship then. So then when they see their pediatrician, like Dr. Ward, those conversations have already been started.
cool. So just a little rabbit trail. Like, Dr. Frank, are you just like incredibly proud of her? I mean, it's like, that's my kid.
Yes,
Yeah.
I am.
Yeah, I'll bet. So, and Dr. Summer, so You've been at Wallowa County for, what'd you say, 6 months?
Yeah, about 6 months.
And is that your first
Yeah,
full-blown
it's my
gig?
first big girl job after
Yeah.
training.
Yeah, so have you seen any, and I know it's only been 6 months, but have there been those occasions where you've had experiences in the last 6 months why it's like, this is why this case, this thing I'm seeing, this is why it's important?
Yeah, I mean, right when I started, I came to the community and there were whooping cough cases that we were seeing in children, I also saw my first ever case of chicken pox that I had seen since I had chicken pox as a kid. So yeah, it was very apparent that immunization rates, like Dr. Frank had talked about, were not where they necessarily needed to be in the county that I was working in, and I was seeing that firsthand in the patients that I was seeing in the clinic and the ER.
Awesome. So, Dr. Josiah,
I can't think of any
talk
better
to me.
words of wisdom that I can follow with all of this. I think the biggest thing with pediatric care, like we said, is protecting the community. I mean, so protecting the adults around the baby is really important, protecting the mother during pregnancy and afterwards. And then when the baby is, first born, we, as the medical society, come to you and say, okay, we have all these immunizations for you. And so parents get really worried and nervous when they say, okay, I want to do these things to your baby within the first hour of life. So I really like what you said about having that visit ahead of time, having a prenatal visit with your pediatrician or your pediatric care provider to discuss what is going to be offered, what are the recommendations in pregnancy, and what should we be doing as soon as the baby's born. As far as those recommendations when they're born, the Hep B vaccine is a really big, important one for prevention of transmission from mom if she is an unknown carrier or she has positive antibody or antigens to Hep B. There are also two non-vaccine related medicines that they do, vitamin K for vitamin K deficient bleeding prevention and erythromycin eye ointment. A lot of times families are confused at not knowing which ones are vaccines and which ones are not, but all three are very important to have. And so I think having that discussion with the prenatal visit with your primary care or pediatric provider at that time. And then having that protection of mom, surrounding community for pertussis, for flu, for coronavirus, because your baby really can't receive any of those other immunizations outside of RSV, which is a respiratory syncytial virus immunoglobulin, which they can get a protection antibody that we've created to help protect the baby in their first RSV season until about 2 months when the baby comes in for their 2-month well child check. And that's a very important visit because they are offered immunizations for which are recommended by the American Academy of Pediatrics, for which I'm a fellow, from the CDC, the Center for Disease Control and Prevention, and the Human Health Services, HHS. So at 2 months, when they come in, the recommendation is to get those 2-month series as soon as possible. Getting them early can be offered for certain ones, but at 2 months, if you wait much longer, you're putting your child at risk for those infections. And so diphtheria, something we used to see in babies a lot, where they get infections of their throat and upper airway, causing severe respiratory symptoms. Pertussis, whooping cough, which in children is a deadly thing. We used to see deaths all the time for pertussis. And then tetanus. So DTaP is that first injection that is recommended and has been out for a very long time, very safe and effective immunization. The other components of those are the poliovirus, the IPV, the Haemophilus influenza, which is a bacterial infection, and then strep pneumococcal, both of which cause severe meningitis, bacterial infections of the bloodstream. It often causes ear infections, sinus infections, lung infections, all of which can be very serious in a young baby. So those two as well. Rotavirus is a GI infection. It's an intestinal bug that causes them to have diarrhea, severe in some cases. I took care of a kid in Texas that had severe diarrhea for weeks after he had rotavirus and was very, very ill. The other immunizations that are offered at that time as well can be something that you would discuss with your doctor. And I think that is the big thing as far as the differences between the CDC HHS schedule and the American Academy of Pediatrics schedule caused a lot of confusion and a lot of families to become overwhelmed with, well, the federal government saying one thing, Oregon Health Authority saying another thing, the American Academy of Pediatrics, the American Academy of Family Physicians, the ACOG, which is the obstetrics groups, have these recommendations that are conflicting. But when you look at the recommendations, They're all recommended immunizations. They just have different components of how the recommendations come across. So 11 of the vaccine components that are recommended for everyone are agreed upon by American Academy of Pediatrics, ACOG, family physicians, and CDC and the HHS. The ones that are not listed as for everybody are still highly recommended or recommended following a discussion with your provider. So I think that's where I find that this is such a beneficial thing, is just getting in for those visits with your pediatric care provider, getting in to have those well visits, and that first immunization visit at 2 months being a very important time to discuss that with your provider. 2, 4, 6 months, you get booster vaccines, and then at 6 months, the child is old enough for that flu and COVID vaccine that you can get in for the first time. And then the next really important well visit that comes up is 12 months, the first year of life, when babies get their first cake and their first ice cream and their first candle and their first 1-year immunizations. Those are when the ones come up that are pretty high risk of school-age children getting. So measles, mumps, rubella, hepatitis A, your booster shots that you get for DTaP, Haemophilus influenza, strep pneumococcal. These infections can be very severe. When I was in Texas, we saw 700 plus cases in Gaines County in West Texas, and I was in an adjacent county. We had 2 children that died at Covenant in Lubbock from measles. And so we've seen cases of these outbreaks becoming very severe. And so when your child reaches the age of being able to receive these immunizations, having those discussions to say, what is my child's risk of these severe diseases? Measles can be very severe and deadly. Obviously, we've seen those cases. Pertussis has killed many babies. Haemophilus influenza and strep pneumococcal for meningitis. I've seen such severe cases of influenza in kids that children die every year from this. And so I think that's maybe something that we forget is in training, we saw prevention of vaccines preventing these infections, and then coronavirus hit, and then families are confused at what to do in general. I took care of families that had 10 kids fully immunized, and on their 11th child, during the pandemic, said, we're not going to immunize anymore. And so we have families that have such high acceptance that are now questioning immunizations altogether. And I think that's where this is important. Physicians from the community, grown up in the community, training in the community, and coming to this area to bring those expertise to a community that has high questions and also obviously cares so much for their family that they want to do what's right and they don't want to make a mistake or make a wrong course direction. And they just need the guidance from the physicians that we have here in the county.
So you said 11 are agreed on
Right.
Okay. And then there are others that deserve a discussion.
They're shared decision making or based on risk.
Okay.
And so I think that's where the discussion happens. So for instance, when a child gets us to a certain age and sexual activity becomes a risk, HPV becomes an option for them. When a child decides to go to college or live in a dorm or go to the military and has meningitis risk, meningitis A, meningitis B, there comes another opportunity for shared decision making. The CDC, HHS recommendations are very different from the AAP, ACOG, and American Family Physicians, so those get a little muddled, and there's obviously some discord even in the federal government recommendations now. We may be seeing some changes there, but I think all of them agree that all of these are important, all of these should be offered, and all of these should be discussed with your provider regarding which vaccines you're going to obtain.
So there's chaos going on, clearly. But it seems like parents and patients are able to make more informed decisions. Is that a bad thing? Talk to me about that.
Sure. So I'm from Seattle, went to Texas, very different culture.
Yeah.
In Texas, the right for personal autonomy was paramount. The mask mandates were not adhered to. The social distancing was not adhered to. It was a wonderful place to live socially, but there were a lot of issues with that. We saw a lot of deaths, a lot of hospitalizations. We saw a lot of utilization of ICU beds and ERs getting backed up. And so I think we saw both sides of the spectrum. A coronavirus pandemic became an issue with the infection rates and people getting sick, dying, and having hospitals closing and diverting, to mask mandates and vaccine mandates and school closures. And so we saw both ends of that. When I saw both of those occurring, I think what we realized very quickly was families were questioning vaccines in general because of such polarization of vaccines in general. You were either pro-science or anti-vaccine, and there was no middle ground. And so I think coming to Union County in Eastern Oregon, I've realized the physicians here are so much more accepting of vaccine hesitancy, which is the term kind of we're taught to use, which is we're thinking about vaccines as there are some obvious benefits. Are there potential side effect risks? Are there things that maybe my child is more at risk, or my older adult, or my pregnant mother, or my pregnant spouse? Yes, and so that's where the decision for the family comes with their care provider. And so in West Texas, we accepted vaccine hesitancy, we accepted vaccine refusal in some cases, and we worked on every visit, every well visit, every sick visit, every visit with a provider. We offered those. We did nurse visits for catch-up. We offered alternative catch-up schedules according to their desire and their comfortability. And when I was looking for a community, I found that Eastern Oregon was exactly where I wanted to be because of that. So I think we're very lucky to have the providers we have here, and I could say that being that I've been all over the world.
So thank you. And yeah, we were talking a little bit offline, talking about your family. And if you don't mind me putting you on the spot a little bit.
I'm used to that.
Yeah, I mean, you have kids.
Yes.
A lot of kids, right?
So my wife and I have had 7 kids.
Okay.
We have found opportunities to raise them in a society that accepts alternative beliefs and recommendations, and looking at things from the whole picture. And I think that's been the biggest benefit that I've found, is that Eastern Oregon fit what I wanted for my family. With we have that direct relationship with your provider. We see the chief of police. We meet the mayor. We
Right.
are with talking to the health authorities of the county. We're going to Chamber of Commerce events. We're meeting with the city hall monthly meetings, and I think that is a very unique thing. You don't often get the opportunity to see your physician out at the market, or to go to church with them, or to have your kids on the same soccer team. And I think that's what my wife and I wanted when we chose a place to locate with our children, is somewhere where we felt safe and community oriented, to where we could have these discussions and be able to meet with people wherever they are, whatever their beliefs are, whatever their worldview is.
And I couldn't agree with you more. A little bit more of a personal thing, and that is, so take this conversation that we're having about pediatric vaccinations and apply that, if you wouldn't mind, to your own kids.
Yeah.
I mean, how has that been a process for you?
It has. I mean, my son's going to be 13. He sees social media. He looks up on Instagram. He gets a lot of information from his friends about COVID pandemic and recommendations and mandates and all that. And I think we hopefully protected them a little bit from that in West Texas. I think a lot of that was safer than, we've seen some negativity come out from mask mandates and closures of schools, and a lot of kids dealing with anxiety and panic and fears that are not necessarily well rooted anymore. And I think we've tried to allow our children to have that mindset. You're going to get information from social media. You're going to get information from your peers. You're going to read information on your own. But you also need to realize there are people that are trusted adults and trusted individuals who have received training and education to help guide you in making these decisions. And so my son has said multiple times with Grand Ron, he's going to be the CFO someday, and I think maybe he will. But I think that's the mindset that we've raised our children to be, is like, don't just take what is said to you on a social media post or in a film, or what a peer has said, and take that at face value. Really look into it and research it, and try to get an information that is rooted in factual evidence, and hopefully peer reviewed by those who have the education to be able to help you. So I think that's been beneficial for him. He comes to me and says, "What do you think, Dad?" Now that I'm a pediatrician, and he never did that before. So now he actually has that more mindset now.
Yeah. So, and I'm going to ask you the same question that I asked Dr. Summer, and because you've had a few more years of experience, have there been times when you've seen, tragedies because of refusal to vaccinate,
Right.
and how did that impact you?
Sure. So when I was in training, they would tell us weekly, they used to do lumbar punctures to do meningitis, rule outs, and they were positive for Haemophilus influenza and strep pneumococcal. On a weekly basis, children were in the ICU and dying from these diseases. In the 80s and 90s, they came out with the vaccines for Haemophilus influenza and strep pneumococcal, and after they rolled those out, we didn't see those anymore. So when I was in training, I didn't see any vaccine-preventable meningitis cases because of that. I did see a lot of pertussis. We still see outbreaks. I did see measles, and we've seen deaths from both of these, even in Texas when I was there and in Oregon. We've seen vaccine-preventable illness, unfortunately, end lives prematurely or cause severe, catastrophic brain damage or organ damage or affect their lives in a long-term manner. And so specifically in pediatrics, I think the biggest thing that I like to present to people is your baby has really limited ability to fight infections on their own. And so without maternal antibodies from her vaccines crossing the placenta and going to the baby, from her breastfeeding the baby and getting immunizations that are then making antibodies to protect the baby, to having those around them fully immunized to protect the baby, your baby's at very high risk of these. As they get older, they get more and more immunity, more and more exposure to things, and a pretty robust sense to things that are common illnesses. So for instance, strep infections, we see a lot of that. We see a lot of non-COVID coronavirus strains. We see a lot of other common cold viruses. We see other bacterial infections that we can fight. And so your immune system over time can be trained and can be guided along this continuum of life to be able to adequately fight infections. And I think to point out the benefits of being in a rural community with good, rooted minded physicians and members of the community, it's about holistic care. It's about health and wellness in a sense of adequate nutrition and sleep and sun and going outside and exercising and maintaining a healthy, weight. And I think that was another reason we chose to be here, is Eastern Oregon has a mindset of we are going to be healthy in a holistic approach, and that's why I think our strong community with CHD and Grand Ronde was such a good, well thought out idea, which came from one of our students that we had from ICOM, which is from Boise area. And I think that's the mindset, is strong immunity. How do we do that? Mm-hmm. A piece of that is immunizations. A piece of that is nutrition and wellness and health and sleep and adequate nutrition and access to medical care.
So, Dr. Frank, I want to come back to you because, you and I met and I interviewed you for a recruitment video, and one of the things that you said that I loved that impacted me was the holistic approach that you've taken to medicine, that there's a special joy. To quote you, I think you said there's a very special joy in taking care of somebody from the very beginning of their life to the very end. And that's cool. It's honorable. And I love that. So, but you certainly have seen some of those same experiences. The same question that I asked the other two docs. Can you think of any time that where it's like, it just hurt your gut because you knew that it was preventable?
Yeah. Specific to the question you asked, Dr. Ward, is there an instance that you remember where infectious disease changed things? As a matter of fact, I was a new doctor, an intern at the Eastern Maine Medical Center in Bangor, Maine. Right, I was on the intensive care unit, and the first person to die on my watch, I had people looking over me, but was a young 30-year-old woman with children that died of influenza, the preventable disease. Of note, the 1918 Spanish flu, it's called the Spanish flu, influenza A, which we just treated how many people this past winter for influenza A, estimated killed between 50 and 100 million people worldwide. And, we say, I don't want to get a sore arm because I don't want to get a flu shot. That's more people that died in World War I and World War II combined. It's significant. The impact that public health and immunizations have is huge, and history proves that.
So let's zoom in for just a second on the flu vaccination. Mm-hmm. So is it all upside? Is there, so in other words, because there are some people that they're deciding to not take the risk. Whatever risk there is, they don't even, is there any downside to taking the flu vaccination?
You could have an allergic reaction.
Okay, all right.
That's the
Or you
biggest
have a
thing.
sore arm.
Yeah, that's the, you have a low-grade temp, you have a sore arm.
Yeah.
But you're not one of the 50 to 100 million people that died of the Spanish flu in
Right.
1918, if it were around. It was, of course, not around then.
Right.
But, yeah, I think we take a lot for granted in our healthcare system. And, that really stands out. There is a great book called The Great Epidemic, and it's regarding that 1918 Spanish flu. And it's very sobering.
Yeah.
Yeah.
All right. Well, yeah. Do you want to
I
follow up
was
with
just going
something?
to say, I think it's not an all or nothing mindset either. I think in talking about vaccines, it's not a failure of the vaccine if you get the illness, right? It's not a failure if you get the flu when you've had the flu shot, because who is to say if you didn't get the flu shot, if you wouldn't have been, in an ICU or intubated or lost your life? Just because you get the disease and you've also received the vaccine, it isn't a failure. It's not, totally black and white or
Yeah.
all or nothing.
Yeah, one of the goals of immunizations is to decrease the severity of disease
Right.
if you should get it.
And I think we missed that. Yeah.
Decreased transmission too. So
Mm-hmm.
if you're infected with an illness and you've had immunization to it, you're much less likely to spread it to other people. So then you're, really tamping down on spread of it locally, spread of it within your family, within the ones you love and the ones you care about. So
Yeah. Well, anything else you guys want to throw in that we've missed?
Oh, I have a whole list of things, but we don't have enough time.
Yeah. No, thank you so much for making the trip and the conversation. And this is good. We need to talk about these things. And at the end of the day, I think the message to patients or parents or whatever it is, just talk to your doc, talk to your provider, and ask them the questions that you might, even if it is, I read this online, can you help me understand that, right?
Absolutely.
Yeah, I mean, because we can't really deal with information if we're not willing to say, hey, is this true? This is what I heard, or this is what I'm thinking, or whatever it might be. You have anything you want to throw in on that? No.
utilizing your providers, utilizing your reputable resources online. So I know we touted social media and online presence as a negativity. That can be a positive too. I mean, you've got good resources in healthychildren.org or immunization.org, or the CDC, HHS websites have information about vaccines. They have the schedule recommendations, what these diseases are. I think empowering yourself by educating yourself as to what these diseases truly are, what are these illnesses, and how severe can they become, what are my options for immunization protection and otherwise, and reading through it, bringing it to your providers as information that you've discovered, and hopefully becoming healthier in mind and spirit and physical, nature too.
Yeah, I agree with Dr. Ward. The science hasn't changed. Even though there's all this controversy, the science hasn't changed. One simple site, the Oregon Health Authority, OHA, great place to start.
All right. Thank you, guys. Thanks for being here. Really appreciate it. And thank you guys for joining in. Appreciate you taking the time to be a part of this tonight. Again, this program tonight is brought to you by Grand Ronde Hospital and Center for Human Development here in the Grand. Thank you guys for joining us. We'll talk to you soon.